Hello, my name is Dr. Robles. I'm here with Gregory Burrell. He's a veteran of which war are you a veteran of?
Post Vietnam.
Post Vietnam veteran, okay. He's 75 years old, and as we'll demonstrate here, he has a severe degenerative disease, severe arthritis of his shoulder. This is his torn biceps tendon. It's not even in the groove. He has what's called Popeye sign. Look toward here. Make a Popeye sign. You can see how the muscle is. There's no muscle here, so he's a completely ruptured biceps tendon. This is a acromioclavicular. This is between the clavicle and the acromial. There's fluid there, and any time now when we move his shoulder, that fluid gets worse, and there's what we call a lot of laxity in movement because the ligament structures are totally deteriorated. Now he's going to put his hand behind his back, and I'm going to show you that he's essentially has no rotator cuff. It's completely torn. He's got severe, if there is a grade, it's the highest grade of arthritic changes in his shoulder. Now this man has been under opioid medication for me, and he's 75 years old. And we did some shockwave therapy today on his knees. Also got a severe degenerative joint disease of the knee. That helped his knee, right? We did it onto his torn. He's got a torn patellar tendon, severe arthritic changes, meniscal tear, medial collateral ligament, all demonstrated on ultrasound. We can't get this individual his pain medications because the wholesalers are shutting down access to the smaller pharmacies. So he may have to not go without any pain medication. And I want to point out some things why this is important. Okay, so point out here. Okay, why this is important is that this man doesn't deserve to be having this type of situation thrusted to him. Quantification of opioid deaths. The problem is we do not have an opioid crisis. That is completely a big lie. We have an illicit drug crisis. From 2001 to 2019, synthetic narcotics coming for our Mexican border, the same borders that we have completely ignored since our wonderful president has ignored them. 1,134% increase. And look at the graphs for prescription opioids. Decreased by 35%. So why in the world are we going to put this man on the street in desperate need for pain medication, so he's not overly depressed, so he's not suicidal, so he doesn't have to live in extreme pain, and force him in the street to buy something laced with fentanyl and then contribute to this? There you have it. Drug overdose death rate among black men in the United States has more than tripled between 2015 and 2020. So is this how the CDC is handling our opioid crisis? Is this is it going after me and shutting me down going to help him? This is, what can I say? Keep looking. National drug overdose deaths number, all ages from 2099 to 2020. 55.4% change. Synthetic opioids. Just in the last year, from 36,000 to 56,000. Over a 50%, 60% change in 1 year. So our way of handling this is to put him on the street, force him to take drugs off the street, then die from an overdose? This is the wonderful plan? What do we know about the opioid crisis? Well, it's pretty basic here. Poppies come, you get poppy pod sap from poppies, you get the opium from the poppy pod sap. White powder comes from the Asia, the black tar heroin, and we already know. Read the book Dreamland. Comes from the Sinaloa state of Mexico. and originally filtered into our Ohio State University in the late 90s. And we got the brown powder, Colombia, Pakistan, Afghanistan. So, and on the final thing is the death rates. The fourth waves of the rise of the opioid deaths. Any opioid, you can see it's way going up. And wave 4, which is basically decrease in interventional procedures. The government not giving any incentive, and because of COVID, people being more isolated, depressed, and suicidal. And that exacerbates pain, by the way. Any opioid going up, and then look at this. Commonly prescribed opioids. That's going down. So everything has to do with the illicit drug crisis coming from our open borders. And by shutting down pharmacies and limiting our drug supply, rather than encouraging good examinations, other alternatives by which to decrease pain, giving every incentive, every option to a patient to help deal with their pain, other than just giving the opioid, but not putting them out on the street, is going to help the picture. Thank you.